Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days? Funding and any kind of further work? NIH research?
As Chairman Crapo pointed out.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up very, very important position.
As he pointed out, Senator, the
right,
portals that were closed were not closed as a result of the Trump
Let me just tell you, I'd like you to explain, excuse me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
you don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees?
Well, President Biden this year changed 3,000 employees at HHS. 3,750 at NIH.
You're 2,200. What departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just, I'm down to a minute 30. The chairman's been generous with colleagues on both sides. I may have to go a couple minutes over, but let me just say, so let's just answer, this would be, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that I take that as that's a simple yes, and I'm going to take that as a no.
Run that agency
I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion or your political agenda or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
So does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government, they come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.